CDC Director Rochelle Walensky signed off on a decision that will give millions of Americans access to booster shots and greater freedom of choice to choose any shot from any drug maker as a booster. Let's get right to Newsy's health and science correspondent Lindsay Thies, who is standing by live for us tonight in San Francisco. Lindsay, this the final step? Well, we've all been waiting for.
Yeah, we've kind of been giving the play-by-play all this week, and honestly, the end of last week as this has been going on, Natalie. But yeah, it is official with this signature and really sign off from CDC Director Dr. Rochelle Walensky. This now opens the doors. It follows that expert panel from the CDC recommending these boosters. Some of the specifics, Moderna, if you had the first 2 shots of Moderna, you are eligible for a booster. If you're at least 6 months past that, 65 and older, ages 18 to 64, if you have some sort of either health condition or you live or work in a place that puts you at a higher risk for a severe COVID infection. If you're someone who had a first dose of Johnson & Johnson and you're 2 months past that, anyone 18 and up, 2 months after, you're now eligible for a booster as well. As far as what happens next, really, there's clinical guidance that will go out to the doctors, pharmacists, nurses, healthcare center workers, people like that are actually going to be the ones giving those jabs, if you will. But we could start seeing, shots in theory tomorrow.
How about that one? And as far as the mix and match, is the CDC recommending one shot over another?
There was no specific go with this version over that version. There was some discussion today during this day-long CDC expert panel meeting, but the official kind of recommendation is if you've gotten those first 2 doses, try to stay within that brand, but they aren't saying no. So the door is open. That option is open. If someone, let's say, got 1 dose of Johnson & Johnson and wanted to go get a second booster dose of a Moderna or Pfizer, for example.
The good news with the winter months approaching, this is really a step forward, a major step forward. Thanks so much, Lindsay Thies, for us, our health and science reporter tonight.